Hi, my name is Dr. Barbara Phillip, and I'm a pediatrician at Boston Medical Center. Thank you for taking the time to watch this video made by the maternity unit staff. The goal of this video is to provide you with information about breastfeeding and what you should expect when you have your baby at our hospital. We want to make sure you have as much information as possible to use as you decide about your feeding choice for your baby. Our goal is not to pressure you in any way about your choice. We have found that many of our patients have the same questions and concerns about breastfeeding, and we hope that this video will help you gain a better understanding so you can make a fully informed choice. So thank you again, and we look forward to caring for you and your new baby. Breastfeeding has many benefits for babies. Breastfed babies have less risk of ear infections, sudden infant death syndrome or SIDS, diabetes, and some forms of cancer. Breastfeeding also has benefits for moms, including a lower risk of breast cancer, ovarian cancer, heart disease, and type 2 diabetes. This is a picture of 1 drop of breast milk on the right compared to 1 drop of infant formula on the left. As you can see, they are not the same. Breast milk contains living cells, the dark circles, fat globules, the white circles, and very special sugars that make it simply amazing. Skin-to-skin contact right after birth is a great way to get to know your baby. When you give birth, your baby will be placed on your bare chest right away and will not be disturbed for 1 hour. This is called skin-to-skin holding. Skin-to-skin holding has many benefits, including bonding, an easier time initiating breastfeeding, and keeping your baby warm and calm. We won't weigh your baby until after an hour of skin-to-skin holding to make sure you both get the benefits from that uninterrupted hour. So get ready to room in with your baby. Rooming in means your baby stays in your room with you all the time. All examinations, vital signs, and tests will be done for your baby in your room if at all possible. This promotes bonding and allows you to learn your baby's feeding cues. Your baby will have his or her first bath after 12 to 24 hours of life. Delaying the bath helps your baby stay warm and keeps the baby's blood sugar in a safe and normal range.
When thinking about how often to feed your baby, don't watch the clock. Watch your baby for feeding cues. Aim for 8 or more feedings in 24 hours, 8 or more in 24. Feeding on cue means your milk supply will be well matched to your baby's needs, and your baby will cry less and be happier. Your baby uses feeding cues to say, "I'm hungry." Feeding cues include sticking the tongue out or smacking the lips, sucking on the hands, and when your baby is just waking up and starts moving around, and maybe the eyes might be fluttering. Proper positioning and latch are very important when learning how to breastfeed. Making sure your baby is latched on well will mean you will make more milk and also will prevent you from developing sore nipples. This is an example of a baby who is latched on well. Notice that the baby has a good amount of the whole areola, not just the nipple in his mouth. His lips are wide open and he's relaxed in a tummy-to-tummy hold with mom. Your baby's stomach is quite small in the first few days of life. On the first day, the stomach is the size of a blueberry. This explains why your baby does not need a large volume of milk each feeding in the first few days.
Introducing formula when you're learning to breastfeed can decrease your milk supply so you make less milk and can change the bacteria in your baby's gut. There will probably be lots of people in your life who are very excited after your baby is born and want to spend time with you and your new baby. Quiet time allows you to take advantage of times when your baby is sleeping so you can take a nap as well. This will help you be ready for the nighttime feedings.
Lots of moms ask, how long should I breastfeed my baby? Providers say, breastfeed your baby for 6 months, then add solid foods and keep on breastfeeding until your baby reaches 1 year of life, or longer if you want to. Thanks for watching this video on prenatal education. This video is for educational use only and does not replace medical care. For questions about your baby's health or feeding, please consult your provider.